Trinidad show.
Right?
Your tango.
Good night, Trinidad and Tobago. It is Thursday, April the 26th, 2018. My name is Felicia Holder, the chairman of the Progressive Empowerment Party. And I am here with my lovely co-host.
Hi, Sarah Nabi here, Head of Social Development, Deputy Political Leader, interim of course, elections in September. Nice to be with you all tonight.
And tonight we are your hosts of the Frontline, usually Janice Lemon Creaky, who is our PRO. You know her, you're familiar with her face. She is not here tonight, and I think most of you would know by now that she has taken ill and she is in the hospital. And I want to take this time to send all my warm wishes, my love, Janice. Get better. I saw you today. You're a fighter. Even in your sickness, you were calm, relaxed. I know you were in a little bit of pain, but you're a fighter, like I said, and I'm just praying for your speedy recovery.
Yes, and on behalf of the PEP family and all of your fans and well-wishers, I mean, they sent a lot of love throughout the social feed today. We got a lot of calls. A lot of them are concerned for you, and the PEP family felt a lot of love today, and we just really want to give you, your husband and your family, you know, our prayers and our thoughts and our well wishes. And we hope to make you proud tonight, because Frontline is your lifeblood, and we really, really, really want to bring it really good tonight. So
yes, this is Janice's baby. Well, we started off with Janice and Tony.
Yes.
And then, you know, we had you as guest, and then I popped in a couple of times. So tonight, I really hope to make you proud, Janice. We're not following your very exquisite format, but
we do what we do.
We added our own flavor to your show, and I hope again that you'll be very proud of us. So tonight the topic was question and answers, and actually Janice and I were going to address many questions that people have for the PEP, for our executive. I still to this day see questions asking, who is the PEP executive?
Are you serious?
Who is the PEP executive? Philip is a one-man show. And
I mean, you all know that we were known as the people who were climbing under the mango tree in January 2017.
Exactly.
That's what we were known for. You know, the mango tree movement, and we got our kicks for it. But I mean, we have a full team. I mean, Philip tags from now, there are always like about 20 emboldened names. You know, I don't know where to start.
Exactly. I don't know how many times we need to say it again, but I will say it again. That was the one of the topics we were going to address tonight. We have an executive team. We have a chairman, myself, all interim. Our deputy political leader, one of two. Our second deputy political leader is Dilworth Braffit.
Yes.
I always get
yes, and good morning, good night, Dilworth, wherever you are.
Yes, good.
Yeah.
It's what time? It's 8. It's good morning,
Good
Dilworth.
morning,
Have a
Dilworth.
great day at work today. He's based in South Korea. Our PRO, Janice Lemon Creaky, our head of PEP Media, our head of party mobilization, Shari Wilson, our head of, well, Dilworth also holds on right now for the head of membership.
We have a deputy chairman,
Sean Sunarine, who was just here. You will see him on Facebook as Trini Mamu. So, actually, even though that was the topic tonight, I'm just touching on it briefly. Yes, there's an executive team. I don't know if you'll think that Philip does this all by himself. I mean, a one-man I know he has done plenty one-man protester, but to actually run a political party takes people. We haven't made it for a year plus on just the steam of one lone man. I mean, he has done a lot, but we have a team here that is behind him, supporting him, keeping this party afloat, managing it with whatever little we have, but we are going, and we're going very strong. And Philip, I thank you for that, wherever you are, and I thank you for the intro music. He gave us some intro music tonight. And also thank you for the opportunity to do what we are doing here.
Yeah, because all of us here, we literally, PEP is just kind of like the common thread that pulled us together from, you realize that, and this, I call us the misfits with a conscience, and if you watch the heavy, hard-hitting social media threads that are there, and I will, you know, I really want to declare, people like Rohan San, Missy Autumn Day, Dave Lux, they are real people.
We have to pick them up.
You know, Ryan Chinsang, our head of youth, these people are ones who sacrificed their time, and they added to our vision, and they are real people that you interact with. We have the head of the advisory council, Kenneth Luke. So when you want the data and you want the information for all the pertinent issues, and I think right now, say for example, as we have Janice, in West Shore tonight, say healthcare, and healthcare is one of our 5 pillar policies, that PEP, the Progressive Empowerment Party, there are a lot of peps coming up all over the place.
Yes.
We're not seeing that.
Yes, a lot
Right.
of Progressive Empowerment.
Progressive
wannabes.
Empowerment Party, that's who we are. We are the Orange Army. Anything else is, we leave them behind.
As we touched on the executive, and like Sarah said, in honor of Janice tonight, as much as we were going down that entire question and answer segment, I hope you're happy knowing who the executive is. Save your questions for next time. But we do want to touch a little bit about healthcare today. It
touched us.
It touched us.
It touched us today. It literally stopped us in our tracks. We had our plans. Everybody had their weekly goals, because we meet here every Saturday. The executive meets here every single Saturday to our, detriment to our family, our social life, our sleep. But we are here every Saturday, and today we just got a message and we got a phone call, and everything stopped.
It did, because immediately, I remember I was up. I'm never usually up that hour. I was
Right.
up after 3, and I saw her post on Facebook.
Oh my God, I was up till after 3 too.
Yeah, and I saw the comments coming down, and immediately you go through the thought process of, okay, one,
Yeah.
where is she? Is she okay? Because
Yeah.
you have to think, is she in public? Is she private? You find out she's in private, you get a sense of relief, because if you're thinking that she's in the public, one, she's probably not going to be attended to that hour of the morning.
Yeah. And we literally need to call everybody and each resource that and it's like whatever cobweb of a family that you have, and you pull and you remember your second cousin married to somebody
Yeah.
who is a doctor down the road. Those are the thoughts that come into your mind when you hear that someone you care about is on their way to a public healthcare system. But she was, we were told that she was in a private institution, and
Which is both very fortunate. I'm happy, and it's also sad at the same time that is the reality of the situation. And while I'm so very happy, Janice, that you are being taken care of in the best way that I ever imagined, because when I visited her today, I honestly had a out of body experience. I said, is this what healthcare is supposed to be like? Is this what people smiling, you speak to the receptionist, she's in that room there. I'm like,
okay.
it's sad that we can't get the same experience in the public.
We had recent experiences. Look at one of our foreign-based peppers, Carla Jean. She and I, about a month ago, we had our episodes, ironically, on the same night. And, Philip highlighted the vast difference in experience that she and I had. And it's just, it took me back. And I think when I got the call and they said, Janice is and so is like, can you do frontline? And I was like, yeah, for sure, I'm doing it. And then when we said, you know what, we will touch on healthcare, it's like it literally took me back to that night, when I was in so much pain and confusion, and my loved ones, they were confused too, because you didn't know what was going on, and the only savior you have, is whoever receives you at casualty. And when you go there and you literally leaning up on the wall, just as I am now, but you're holding, just as I am now. I don't know. That's just gonna, maybe I don't know. Maybe it is I am really remembering how it was there, and it's like you're holding your head, and the worry and the anxiety that goes along with being sick is one of the things that is just absolutely sickening and unacceptable. It's one of the reasons why the healthcare policy is something that we hold on to and we advocate for, because regardless of it, it's not just, and Felicia will give you the snippet of what it is, but in essence, it's not that we're saying, poor people deserve health care. No, that's not it. Even if you have some dollars in a bank that are already robbing you, it doesn't mean that from the time you need some assistance, some medical assistance, that your money has to be held hostage. It's not right and it's not fair. And please, feel free.
Well, as you know, we have 21 policies, and we're touching on healthcare tonight, which is number 5 on this policy. And guys, if you have not yet had a look at our policies, this is what it looks like.
Yeah.
Both of them are stuck together. It's on our Facebook page. When we have our meetings this Saturday, you can come collect your flyers, distribute to your friends, your colleagues, etc. Because this is the map, the road map to undo and redo Trinidad and Tobago. Progressive ideas, you can't beat us with that, honestly. And as we're touching on healthcare, I'm going to read this one out for you, for those who don't know it, and if you do know it, it's a reminder. First World Healthcare. Build and operate 41 constituency healthcare facilities, complete with accident and emergency minor surgery services that would put healthcare within easy reach of all citizens, 24 hours a day, 7 days a week. Deploy professionally trained call center controlled paramedic ambulance service to fire stations, health centers, and or police stations to allow for emergency responses in under 10 minutes nationwide. Not half an hour, not 2 hours after, not the next day calling you asking if you still need it. 10 minutes. Monitor the fleets of ambulance via GPS.
And Trinidad is so small, and I mean, even if you thought that it was pie in the sky, the night that Carla Jean and I both got ill on, wherever we were geographically, I was in Trinidad and she was US based. She was in and out of the hospital with a full diagnosis and treatment plan, and I still had not seen a doctor. And
I remember you were both in the hospital at the same time this year.
Yes. So when you all called me and you texted and you wanted a check-in, I saw on the thread that Carla Jean was ill, and she wasn't even home. She had to pull aside on the road because she was driving, and the ambulance was able to reach her, and she was able to be shuttled there, treated, stabilized on her way home, and I literally was leaning up like this in Boyer's propping up, and I have my purse, and all I know how it is, when all I go casualty and you go there, you scope it out, and you're like, okay, I feel like something hurts in my hair, so it's like I need 2 chairs and I need to kind of stretch because I know I'm going to be here sometime, and you're trying to figure out how it is that you're going to settle yourself down for a wait. And that is something that we're so grateful that Janice didn't have to feel, but we are people who, when we hear these stories, and last week on Philip's radio show on 104.7, he recounted 2 stories that came to us. One was from a European-based pepper who spoke about the passing of her mother and her treatment in the South Hospital. And then we also spoke about someone named Fatiha Ali. She reached out to us and she was trying to get some information and was trying to get some assistance because her husband, fell and hurt his elbow, and now he has an infection, and that was November last year, and come April 2018, the man hand, they're trying to figure out if they need to amputate the hand that had the cut, and then now he has a mass infection throughout his body. How is that? How could you comprehend that? And we're not even talking about the affordability that goes along with this healthcare. We're not talking about the level of reception that people, that people receive once they go there. And if any of these things appeal to you and connect with you, and you want this message out there, we want you to, just take a pause and share the live so that people could understand, what we're about, and you would realize that we're trying to connect with people out here. And there's nothing more universal and understandable that healthcare is something that affects us all. And even though we're all mortal, because everybody is like, we had a dad and you had this. No, 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 no. That's not what it is about. Quality of life is utmost in priority. And as the head of social development, I could say that. And when we start rolling out and you start coming out, and when people start coming on and engaging us in our public forums and talking about, and challenging us on our questions and getting information, is like that is when we get to unpack, and then also too we get to learn from you all what it is that we miss, what it is that we need to contextualize, and we need to edit, So I know I talk in plenty because I feel in plenty, because I felt it as a patient, I felt it as a witness, to a patient, and
No, you're talking and I'm listening to you, and I'm also reading this again because this week Tony and they on the 411 they actually called me 10:30 in the night as usual, late Tony, telling me that he needed me to do a voiceover of all 21 policies, and they wanted it in half an hour. It took me an hour and a half to do because the dogs are barking in the back. How kind of man is? But the one thing I did appreciate about the exercise though, and thank you for this, Tony, this is why I did not call you the next day and get on, was that it actually gave me another opportunity to refamiliarize myself with the policies. And every time I read it, I apply it to some new aspect of life. So I'm reading this here and I'm thinking about so many different scenarios. I'm thinking about yours when you just said you had to prop up yourself and wait in the waiting room, whereas our colleague in Florida was attended to and discharged within what?
3 hours.
Within 3 hours.
3 hours.
And then I'm thinking about Janice's situation, and I'm thinking about other people that I know who have suffered as a result of something as simple as your constituency health care center is not equipped to deal with your pain or your sickness. And you have to be imagine, think about this. And I have a colleague who lives in Mayara, and she tells me stories that I'm starting to not realize, but it's a pattern now. Somebody falls ill in Mayaro, the nearest health center is in Grandi. Now I drive from Port of Spain to Mayaro sometimes. It's a 2.5 hour drive. From Grandi to Mayaro itself is almost an hour, half of that. So imagine you have some kind of emergency, and to get assistance, you have to leave from Mayaro in the winding coconuts to get to Sandy Grande.
And that's provided that you have a vehicle.
Provided you have a vehicle.
And then provided you have support to organize you. You don't have kids that you need to organize and find a way to get them there. So you understand now why you hear a lot of people when they come in, you're like, why didn't come sooner? Why couldn't we catch this? It's like because they literally couldn't find the time. Because I'm telling you, if people have pain, it's not like they're going to say, oh, I'm going to live with it because I'm looking for a challenge in life. No! If I get a small paper cut and I can fix it, I will go and fix it. Give me the bandage.
That's the thing. The health care centers, I don't, not that I am far from a hospital. I live in Belmont, so I'm right there from the Port of Spain General Hospital. But it's not that I don't have access, unlike the people of Mayaro and Guaya who have to go very far. It's that I've taken a day to go by the doctor in the hospital for something that you don't consider critical. Even though I'm not a doctor and I can't diagnose my pain. But sometimes there's a level of self-diagnosis because you don't want to encounter what you know you're going to encounter.
And then you got
some things you know you have to take days for in Trinidad and Tobago. You have to take a day to go and renew your passport. As much as that is literally a half an hour task, you have to take a day. You have to take a day to do anything month-end in the bank. That's a full day.
For real.
And you have to take a day to go to the hospital. I broke my toe back in 2016 and I still went and played master. I broke my... I didn't know. I thought I sprained my toe, and like we were talking about that camphor thing today. My aunt told me put some camphor in it. Put camphor in it and wrap that up, and I went and I played master.
But you understand now why we hold on more to traditional medicine too, eh?
Yeah.
And I mean, apart from the fact that these things work, But
not camphor, sorry, soft candle. I put soft candle.
so she put a naphthalene ball.
No. I wrapped it up and I went and I played mass, and the week after, probably going on 2 weeks after I broke my toe, I went to the health center and I found out, my toe was broken. But that's after living with the pain for that long. Huh?
Sure.
But one of the reasons I did not want to go, and it is exactly what I did experience when I went, was I had to sit down in a waiting room, wait for a number, wait for the nurse to come back, go, you're dealing with, and I'm not ponging the people who work in the health centers. I met some really nice nurses, and I have to say that it's always, I don't want to say it's touch and go, but you can't class everybody. There are those who really try hard and put the effort to be good, and not good, but nice to their patients and to people.
And I could testify to that because those, the doctors who saw me, who eventually saw me, and, the nurses who took care of me in Ward 23, thank you very much. I appreciate it. I appreciated all of you. We had some laughs and, in the suffering.
Yeah.
Right? Because, somebody bawling at 12 o'clock, 1 o'clock in the morning that they need a Panadol. And they saying, sorry, love, but they cleaned out the wards of paracetamol and Panadol because they don't have stock, so they're all down in casualty. So, think about that, right? And the people who we subject, who usually, if you look at the demographic of the people who suffering in a hospital, it tends to be people, of a certain age. So they already have certain challenges. And then you go there, and they're going to suffer some more. And then the family that's supposed to be taking care of them, they're busy working, they're busy minding the children. So who is it really offering the care? And the burden goes on the nurses. And as you say, it's a touch and go kind of system. And then when you're in I'm telling you, when you're inside our place, just being in there, I was fortunately next to a window, and I was around pleasant people who could have handled their illnesses with a positive attitude. But I could tell you, just being in a healthcare facility is the last thing you want to do, with the time that you have on this earth. You see, that's why I tell you, it's like I feel plenty when it comes to this. It's like,
I'm again reading, and I mentioned it earlier, emergency response in 10 minutes nationwide. And of course, all of these stories are flooding back to me now.
Yeah.
But the same Miara situation, if something happens to you there, what is the likelihood that you can get an ambulance coming to you in 10 minutes if it's coming from Grandy?
Yeah.
I don't even think with the fire station, or they still have to transport you to Grandy Hospital if something serious happens. And if they can't deal with you there, they then have to transfer you to either Mount Hope or, well, usually it's Mount Hope. But think about how many lives have probably been lost because of not being able to get medical assistance
I'm thinking about how many
time.
preventable deaths, that we could have had. I mean, and then we talk about this, and I'm thinking, remember Christopher Phillips? Sorry.
That is a tough one for me. It's always been a tough one because remember when Rowley said he draws the line here? It's not that I draw my line, but I honestly did not understand how
I thought
people were not.
We thought that was enough. We thought that was enough.
Who did it have to be for us to say, nah, that was too much? Like, who did it honestly have to be?
It's KFC.
What?
That's what it has to be, because if you're looking right now, that's what it is. It's not a who,
That's
what it hitting you
now. KFC, and you wonder for these serious issues like this, and I see on my newsfeed, I see the people, my friends, my colleagues, who are very silent on anything I post about the PEP, but I read their comments, and I read when they have real life experiences in Trinidad, and I read, boy, I went to the licensing office and I ain't got my license. Now this one wasn't here today. So I have to come back the next day and I read, boy, went to the hospital and I had to wait a whole how much hours, and I wonder, I think to myself, you're living the experience. You it's not that what I am seeing is any different from what you are experiencing. So what is stopping you from saying, I can't take this anymore?
Yeah, and what about the ones who actually, when they're so celebratory because they get through? What is that about?
Exactly, and you see it too. You see people posting, anybody knows anyone in any doctors in Port Moresby, anybody knows any doctors in Mount Hope or this health center. And I mean, of course, it's sad that that's the only way to get expedited service, but it's a reality. If you have to know somebody to get through.
Not even that, Felicia. It reached the point when because of the condition that I was suspected to have it, so basically when I came in, they were like, you know what, you're gonna be warded regardless, because they can't let me leave with what the suspicion was, with the injury that I came with. So while I'm there, propping up on another chair in another room, it's about 2 o'clock in the morning, so the shift has changed. And I'm hearing the doctor calling around, like the nurses in the wards, and they're saying, I have this patient, so this is what she's suspected to have, so we have to keep but the ward she's scheduled for full. You think you could do me a favor and hold she?
What does that mean? Hold her?
As in hold in the ward, as in you have a bed for her, even though she's not scheduled for the bed. So because the ward that I'm supposed to be in, it's full. They can't take me. They can't hold me. But they can't let me leave because of what I come with.
Yeah.
Right? So they were asking around, on kindnesses. And that's the thing you see. You see a lot of doctors there and nurses there. And we literally survive based on the kindnesses of professional strangers. So when you're in the hospital, it's professional strangers. And it's just that they have so much pressure because as the same thing you say is like people calling around and they're asking them and they're saying it's like, could you check this one for me? Could you check that one for me? And it's like, I don't go through all that nonsense just to see somebody. It's like, no wonder.
I always used to wonder, before I got involved in people, I used to wonder what was the reason that when you walked into Port Moresby or any hospital, mostly Port Moresby in general, I've seen, to me that has been the worst. I've never really experienced San Fernando, but there's always a full waiting room, people sitting on the ground, people standing up, they're leaning on a bench, and it's always sad to look at because it's usually a lot of elderly people, some young children, and it's not anything that you would want for yourself or for somebody that you care about. And understanding now that it's probably one of two, not probably, it's one or two things. One, inefficient management of the hospital, because you have to know how many beds you hold, how many patients that you can take, how many nurses and doctors you have on staff, how many trolleys that you have to transfer patients from vehicles or from the ambulance to the hospital bed. So clearly there's some disconnect there between how they run the hospitals and how the patients are being treated.
Right.
As one.
Right.
And then two, the fact that a lot of the people who go to the general hospitals probably could have had what they needed dealt with in a healthcare center.
That's closer to them, that would be more affordable, that would be more convenient.
That would have the drugs that they need. I went, after I got in my accident 2 weeks ago, the doctor prescribed some tablets for me. I went to the health center by mistake. Because I actually thought I was going to the health net.
Yeah.
But apparently they moved and it's now a health center.
What?
Only while I was there.
Are you serious?
Only while I was there, I realized that it was the health center. I was already there, so...
You see how irritating the things that are changing? It's like, look at the things that are changing. It's like everything's staying the same in this place, You pass by is one. It's like about 5 blocks falling off of a wall somewhere after a year. But look at the things that are changing.
But I just want to plug it. Could have been me. I am sometimes I'm not very observant, and apparently that changed from health not years ago.
Yeah.
So I don't know, but I ended up staying and went through the doctor. His diagnosis of me was literally watching at me.
Yeah.
Where do you have your pains? And I'm just there. I'm like, Lord, look how I'm just gonna get.
Yeah.
Just like basic
Yeah.
treatment. Like, well, I'm having some back pains because of the accident and whatnot. He prescribes tablets to me. And before he even finishes, he says, most likely the dispensary won't have these. So you will have to go to St. James Hospital. I said, burr? Burr?
Yeah.
So I had to leave. I'm telling you, I'm in pain. I had to leave.
Yeah.
I had to go to a meeting. Leave the meeting in pain to go to St. James Hospital to get the tablets. And that doesn't even touch on the point of the fact that some of the drugs now is not even the real thing. Anyway, so guys, I know we said we wanted to take some calls.
But you know, you realized we needed to vent.
Yeah.
So we
It's turned into-
ventilated a bit.
It turned into a real venting session about healthcare, and I'm going to get a little angry here because something happened, and we do want to open the phone lines. But
4694349.
please call in. Give us your experience with anything in the healthcare system, anything that you think can be improved, anything in our policies. that you can
Anything
see
at
apply.
all that you want the audience to know. Anything, because just by you calling is you becoming an active participant, in your nation's affairs. And that's what this platform is about. That's what Janice wanted Frontline to be. And we welcome all calls. We appreciate you all giving us a session. You see, here we are.
Oh, we're getting a call.
We're getting a call.
Seems like it's an overseas number as well. Hello, good night. You're on Frontline.
Good night. This is Kenneth Luke here.
Hi, Kenneth.
Hi, Kenneth. Kenneth is
How you doing?
the chair of the advisory council. This is Felicia and Sarah. Hi.
Hey, Felicia. Hi, Sarah. Good evening.
Good evening.
Wait, are you calling for Frontline?
Yeah, I'm calling.
Okay, good. Next time he was calling.
Yeah, maybe I had an assignment. Okay, go ahead.
No, I mean, I am understanding the challenges that exist.
Continue.
I'm hearing the challenges that exist, but the PP is basically working on healthcare policy to drive clarity to. Can you hear me?
Yes, we
Yes,
can.
we can.
Live and clear. You just go ahead and speak.
Hello.
Yeah, okay. What I was saying is we're trying to drive clarity to understanding the challenges
Right.
and also beginning to put structure in place so that what we end up with is on a full assessment of the resource. For instance, what is the service structure in each facility by facility type and what that should consist of? We're thinking in terms of, or we are documenting in terms of electronic intake and patient registration, triage, which is something that will mitigate the people sitting around in the room.
Read
in
the rooms,
the
right?
waiting room.
Yes.
Of course, waiting room and bathroom facilities.
Right.
From a service standpoint, we can't have people sitting on the floor. And we can't have
Exactly.
people waiting to go to a bathroom that normally they cannot go to.
Right.
An emergency room with private ER patient stations, electronic access to patient electronic medical records, which is a standard thing where somebody comes to the waiting room.
Yeah.
And don't sell out all our secrets. Just now you know you're gonna hear somebody from the yellow and steady or the red and ready party talking about waiting room facilities. You know how
Yeah,
this
but their problem has constantly been implementation.
always, and that's where the
Talking
PEP
about
is different.
strategies to implement.
Yeah.
Right.
So giving effective service means you must be able to do the capacity planning that you can understand the size of your facility and the population that it can serve. And we need to configure the available services to constituency by urban, rural, hill territory and coastal territory, because each of those needs are different.
Yes.
Right.
People, for instance, live close to forest, could suffer from snake bite, whereas in Port of Spain, unless the zoo get away, you're not going to get too many snake bite people. The
Right.
other thing is transportation.
Mm-hmm.
And actually the medical professional distribution by population within regions. So some kind of survey is necessary to understand the capacity and resource planning for training. And who we got to train, and the degree and levels of training. For staffing and resource planning, it is the intent of the PP to fully staff these facilities 2 8-hour shifts, 365 days per year, 8 a.m. to 3 p.m. and 3 p.m. to 11 p.m. and 1 8-hour shift, 365 days per year, 11 p.m. to 8 a.m., which of course can be a lighter duty shift. Now there are some other things that touch this. What are the housekeeping services in place? What is the bed count in each? Are patient facilities adequate?
Kenneth, I think,
systems apply?
from the time you started, and guys, for those who don't know, the advisory council is that board that takes all 21 of these policies here, and this is where people get confused. They see our policies and they say, oh, that just them bullet points, what y'all have. The truth is, we have a team that's being led by Kenneth Luke, and what he's giving you there is the real drill down, point by point, bullet by bullet, of how we are going to reinvent the healthcare, revolutionize, undo and redo the healthcare system. And Kenneth, I want to thank you, for giving us that insight. Actually, I should have actually called you earlier and asked you to call in. We're going to cut you now to take a couple more calls if we can squeeze any in, but I really want to thank you for giving us that insight into how we are going to address all of these issues that Sarah and I brought up about the healthcare system.
And you gave people a lot of food for thought in a 3-minute bite. It's so long, and I'm sure people are gonna have to. I know once this live is over, we're gonna have to actually go back, and you're gonna have to play
comments and
read the comments and listen to it and think about it. So thank you very much, Kenneth, for your contribution tonight.
All right. Thank
Have
you.
a good evening.
Same to you. Good night.
All right. Anybody else, if you do want to call in, like we said.
Right. The number is 469-4349. Yeah, that's a lot of fours.
469-4349. We're talking about the healthcare system, and just the things that Kenneth is saying there, it tells you the amount of depth that we are going into to make sure that when we say we want to give healthcare to our population, and first world healthcare, what we really mean. It's looking at all the issues we pointed out, having to wait in the waiting room, having to deal with a snake bite versus another bite, and getting another call.
Hello, good night. You're on Frontline. Sarah and Felicia here.
Yes, good night, Felicia and Sarah.
Good night.
Yes, I was in there with some heart issues.
Okay.
And there was no medication on the wards in Mount Hope.
Right.
And another thing is, during the weekend, people required angiogram and ultrasounds. And they don't operate over the weekend.
Is it that you had to get an ambulance to get to where you were coming from?
No. I needed an angiogram while I was there.
Right.
And they don't do that over the weekend. You have to get a stress test. Any machinery have to be operated. The people who operate them, they don't work on weekends.
Right.
Wow. So you had to wait until Monday.
This is the biggest hospital we have in Trinidad. This is craziness.
And when you hear the statistics in terms of our healthcare and our health diseases and lifestyle diseases, you would think that priority would go into these tests, at least in terms of angio. Exactly.
Yeah. Caller, where are you calling from? What area is this?
I'm calling from the Cuba area.
Area. Thank you for joining us.
The amount of money spent in healthcare over the years, and they can't get nothing right.
Yeah.
When Philip started talking, it's just ideas coming out of his mouth like crazy.
Right.
It's nice to hear it, But then I get vexed because these stinking PNM teeth in it. You understand? Tell him to shut up.
But like what Kenneth said, their problem will always be implementation. And you can always have an idea, but not because you have the idea means you know how to put it into action. And that's where, you see, their whole blueprint is how much I could get from in my pockets. What we studying is to take the money and actually invest it in the people.
Yeah.
I actually went to align my tires, and I was talking to some people from Tobago and gave them some flyers, you know?
Yeah.
Gave them some flyers. And she was saying, you know, how is this first world health care going to happen? I work on Tobago. I said, ma'am, you just call that office and they will tell you what is going to happen.
Yeah.
And they have people in Tobago. So anywhere I go, I tell people of the PEP and tell people, spread the news.
Thank you very much for that.
The nonsense, the bacchanal. We're talking about healthcare. We're talking about ensuring that people can get their tests when they need it. We're talking about people having safe transportation. We're talking about people that if you need to go somewhere, you are secure in your knowledge that they're going to be treated. And Kola, did you get through at least?
No, I didn't.
Really see?
I never got any tests done, nothing done. My wife had to bring tablets on the ward. They took away my tablets and gave it to other people.
What?
So imagine, I had to buy tablets for people in the hospital. You understand?
And the sad thing is, you're calling from Couva, where the first thing is that Couva, they just spent how much was it?
Not they
almost
spent.
a
We had to pay it back. Is that the Chinese built it?
A hospital, a Couva Children's Hospital that is just withering away in Couva. Money that could have been pumped into upgrading the Mount Hope, Port of Spain and San Fernando facilities so that you will not have to wait until Monday and probably never get your test results. Because as you're saying, you never even got that.
But Kola, I want to thank you for sharing that. We appreciate your call, and we appreciate you spreading the word and letting people know about PEP, Progressive Empowerment Party.
To you and Felicia and Trinidad, everybody working hard. The word is spreading. People are finding out. I went to some lady in a back road somewhere, and she said, "PEP, yeah, everybody know what PEP."
No,
and it's spreading, so don't worry.
That is good news. Thank you very much for calling.
Okay.
All right.
Okay, bye.
Take care.
Bye.
Good night.
Wow. I mean, we glad that we're taking the call, but you realize we have to actually take our breather, and we're incensed by what, we're hearing.
Oh, yes, so we're going to call our darling
Yes.
Limbs.
Right. She's our caretaker for the
Port of Spain North, St. Anne's West.
Hello?
Hi, Lemma. Sarah
Hi.
here. And Felicia on frontline, and ready to unload your story. Go ahead.
For those, just know Lemma, before you start, for those who don't know, Lemma is the caretaker for the St. Anne's Port of Spain North, St. Anne's West constituency, or St. Anne's East.
She was recently featured on the 411.
Yeah, she was on the 411 last week, and she's now going to give us her own experience as it pertains to her daughter.
Yes.
When she had to go through the public health care services of this
Go ahead,
country.
Limbs.
Limbs,
Okay.
the floor is yours.
Well, it was a weekday. My daughter was in school, and a group of children were playing, and she tripped over another child and she fell. And she broke her left arm.
Right.
And the school, from the time they saw how she made a lot of noise, they realized how serious it was. And they took her to the St. James Medical.
Right, to the St. James facility, right?
And the doctor there, well, they saw her immediately because she's a child.
Right.
And it was a severe injury. They told, as soon as I reached, this was around after 10 in the morning, I got there the 11. And from the time I reached there, the doctor was like, "Mommy, I am not an orthopedic surgeon, but I can tell you for sure that arm is broken and you're going to have to carry a mount. There's no buts about it, you have to go mount."
Right, so after 11, you're shuttling down to go down to Mount Hope.
Yeah.
Right,
So we left Swatter. We left it. They said we couldn't take the ambulance because there was no ambulance close by. So,
So she's in pain all of this time?
yeah?
She's in pain all of this time?
They gave her pain medication. So she
Okay.
was in pain, but just with the discomfort.
Right.
So
So
they put the
small
ambulance sling
mistakes.
and the pain medication, which was Panadol.
Right. So we have a 4-year-old with a broken hand on her way after 11 in the morning after
Yeah.
seeing one facility being rejected and transferred to another. Okay. Right.
Yeah.
So we on there now to Mount Hope.
Right. So we had to take our personal vehicle to go
Right.
back. And when we got there, which was around after 12, we did the whole procedure. You speak to the nurse and you register the patient, you assess the patient, and you sit down and you basically wait. And we waited.
For how
And
long?
waited.
For how long?
We were there from 20 past 12, and we did not see a doctor until around 5 past 6 in the evening.
Oh my God. Oh yes.
So what were you doing all of this time?
Right.
Every 2 minutes I'd get up and speak to the doctor and ask them, I'd have to remind them to give us pain medication because of the injury.
And how was your child? I mean, she's 4. She's in this
Yeah.
room in pain. I mean, how was she as you were monitoring her?
She was brave. She didn't cry much or bawl or anything because of the sling.
Right.
But she wanted to go home, and it was too long a process for a child so small because she wouldn't know what to do with pain. As an adult, okay, suck it up. I could deal with it, but
And
as
for
a child,
something
you can't.
And for something so critical as well, because I mean a broken arm is not the same as my broken toe where I could jump up and
Yeah.
still play mass. It's a broken limb that is
Yeah.
pain,
it
and she's
was
a
bruised
child.
and twisted.
Yes,
It
that's
She's a
was
baby. I
brutal.
still call her 4-year-old a
And
baby. a little
exactly.
baby.
Yeah, and when I spoke to one of the doctors, he said that, yes, it is serious, but it's not critical. So that's why we were allowed to wait. So they are assessed by how serious. So I suppose if I went in the ambulance and I came out screaming and crying, oh my God, my child, help her, they would have rushed her in immediately. And then so the trick is to get the ambulance, but then they did get the ambulance.
Oh my God. Now,
And it's hard to see a child go through that too. I
sure.
wanted to cry for her.
right. And I mean, you and your husband, both of you all had to take work days off, basically, to get this done.
Yeah.
The same thing Felicia was saying. And you all had other kids. So what was the shuffle for you to have to be held hostage there? What happened to your other kids? Who?
Well, at that point when we realized we'd be there whole evening, I had to call my mom and ask her to pick up the other 2 for me. And she said no problem. She would sing. She said, make sure I'm stay with her. And she was going to pick up the other 2. She will feed them everything. And after seeing the doctor, who was the specialist, the orthopedic specialist,
Yeah.
he told us that he would wait 2 more hours till her stomach completely empties in order to do the procedure. So we had to wait a further 2 hours. So basically the procedure was supposed to be done like 8:30. So I told the doctor, okay, I live right there, Belmont. I am going to carry my child home. And I need to bathe and change and all of these different things. And we will come back.
Okay. All right. And she eventually she got the procedure and she's doing fine, right?
Yeah, and we left there. We came back 8:15 and we still waited until after 9, and we left there 10:30
I remember that night when we asked if you were home, and it was really late that you messaged.
And you know what was the upsetting part the most too?
What's that?
At that hour, the hospital pharmacy is already closed. So you now have to go and hunt for a pharmacy that is open.
Oh Jesus.
Because you want to make sure your child have the pain medication for when she wakes up in the night.
Yeah.
So the only available pharmacy is Super Farm. How ironic is that, right?
You see why we enraged? You see why we fed up? You see why the whole segment ended up being about healthcare? Lemma, thank you very much for that story. We even apologize for you having to rehash it. you know,
Yeah.
because it's not an easy thing. I mean, when you look back on the video and you would see the frowns on police and my faces, even though we try not to. And thank you very much, Limbs.
Thank
for
you,
this.
Okay, no
Emma.
Right?
problem.
Give our love to Steve.
Yeah, thank you.
Okay, take care. Bye.
Okay, bye.
Take a drink. Right? Share the live.
Clearly not Tom.
Roll
I'm
your
drinking the
eyes.
wrong thing. What?
Praise the Lord for patience.
Guys, we have 5 more minutes before we wrap up the program. I mean, you've heard it. We would leave room for one more call if anybody wants to call in.
Yeah.
At this point, though, I do want to, again, we spoke a lot about the issues. The solutions is what we need to be focusing on as well.
Yes.
PEP is not just here to dig up all the problems and say, well, yeah, and blame the opposition, or blame the present government. Yeah, it's their fault. And I meant to no words to say it's their fault, because 56 years, in and out, paying emergency, and the child had to sit in pain with a broken arm for more than 12 hours before she got full attention. What is our money paying for? Why was there not a facility? Why was there not a doctor to attend to her? Why was she not classified as important enough? I'm not saying that there aren't other things that are critical, but like Kenneth Luke was saying, you need to know how you are running a hospital, and that she had to go through that, and comparing it to what Carla Jean had to experience in 3 hours, when I think she was feeling lightheaded or something like that.
Yeah, she was, and she was driving and she almost passed out, so she pulled over before anything happened.
Compare that to a broken arm on a 4-year-old child.
And
These are things that should not be happening.
And the
in
thing
2018.
is that, you know, I have examples that work. You know, there are companies, you know, global companies like GBG, you look it up, where countries invest in healthcare and insurance for all of their citizens, so that something like this never happens. And you know why? Because they value life. They value you. They value the citizens. They don't tell you we're going to raise health charge. They're not going to say we need to bail out National Insurance Board, but we need to pay taxes even though we're going to run out of money. You understand? They're not going to say that. Our citizens, we need healthcare, they invest in healthcare. And the thing is that with Trinidad, is like we are the 3rd wealthiest nation in the Western Hemisphere. So something like universal healthcare, or having a global insurance company to that would surely give us a reduced rate, because I mean we are 1-point-something million, not counting the immigrants, not counting the ones that we can't access when we have to do our census, because anybody who knows research, you know, we'll capture everybody, right? So think about it. And the thing is that we literally have literal examples, parallel examples happening in countries and our neighbors at this moment. Carla Jean was just a perfect example to show us, hey, this is what could happen in 2018 this year, you know?
As we begin to wrap up, if we don't have any other callers, I started earlier saying, and I don't want to end this show angry, so I'm not going to dip into my angry feelings.
Because we are the party of hope and opportunity. Yes?
I got into a very loud argument this week, and I was going to save this story for the entire executive this Saturday. I got into an argument with the owner of Joe's Pizza and a customer in the establishment. I believe he was the owner. He was not a bad person, but my anger was mostly geared at the customer, who I overheard them speaking about politics, and being a brand ambassador for PEP, being the chairman of the Progressive Empowerment Party, I saw it fit to say, okay, y'all are saying PNM and is nonsense, UNC is nonsense. Here we have an option. And as soon as I mentioned it, the customer immediately cut it down. Oh, for the better with Alexander, that con man. Say, where's your proof of all these things? Well, I hear. long story short, we got into talking about fixing the country and the policies and the programs and the systems that we need to fix this country.
Right.
And I mentioned to him,
Yes.
you know, why not make an, while this is not about healthcare, but
Yes.
it touches on giving hope and opportunity. Why not give a minimum wage earner the opportunity to own a home? Why not give, and if we have to relate it to healthcare, why
Yeah.
not give the poor man the ability to go into a hospital and get the same service that you would go
Yes.
and pay thousands of dollars for in West Shore and St. Augustine and St. Clair and all of these
Yes.
other places that are designed to take your money, because you know you can't chance it in the public.
Yeah.
Why not give them these things? And the customer's response, well, actually, the response was, why should my tax-paying dollars go towards that? And I felt an anger bubbling inside of me. It was
Wow.
bubbling inside of me. And I wanted to cry because I realized I was angry because we say that we don't know the solution. And we say that Trinidad has a problem. But the problem with Trinidad is really us. We are such a selfish people. Think about if the poor man could access health care. The poor man could own a home. What does that mean for the country as a whole? As a country, we would be all progressing together. Why
Mm-hmm.
are you opposed to taking your tax-paying dollars to go towards making something as healthcare and home ownership affordable and available, but you would rather that money go to
Whatever else.
feeding criminals in jail?
And even if you find yourself from a privileged situation, why it is that you have to use the resources that you have within your privilege to be raped by the hospital with respect to the fees. You don't think you deserve better? You don't think you're worth more? And I mean, however you have your income and whatever savings that you have, you should want for yourself, and your savings should mean something more. That, you know, if I'm in a serious situation, I can bail myself out. And then what happens after you spend all your money? Say something happens, and you know, say whoever we have is like they're in the private healthcare, but hey, you know what, they run out of money, we need to transfer them. Oh, we can't afford that anymore, we can't get them in public. What's going to happen? And this is where the Progressive Empowerment Party members come in. We are seeing something, we are seeing a picture, we are seeing a roadmap to something that we truly reject. And instead of outrightly rejecting it, we are trying to be part of the solution. And at least we have a platform for you to start and to come on board. We trying to help relieve the pressure where you don't feel alone. You have myself, you have Felicia, you have Philip, you have Tony, you have everybody who you plan to vote into to be the Progressive Empowerment Party for this next year.
Yes.
And you have the choice for that. So as we're going to close Felicia, is just going to do some basic housekeeping before we sign off for the night.
Folks, thank you for
Thank you.
joining us on this unscripted hour. Normally, you know, we have our little scripts, totally unscripted.
Yeah.
Went off, not what we...
Clearly we went off.
No, we were on topic of what
Yeah.
we wanted to discuss coming out of Janice falling sick,
Yeah.
but not on the, you know, the whole inside look into the PP. But things happen for a reason, and I was really glad that we had the opportunity to
Yeah.
discuss this tonight, because we heard how bad it is and we heard how much better it can be. You heard Kenneth give the simplest solutions to fix the problems that are so big right now in our healthcare
And that was the
system.
tip of the iceberg when it comes to Kenneth.
Tip
And
of the
If you
iceberg.
come on a Saturday
You
and
would
you get to
hear.
engage us, it's like you would hear a lot more.
So this upcoming Saturday, which would be the 28th of April, we resume our noon meetings right here at 19 Stanmore Avenue. This is a glimpse of our office. We have more space. But definitely come down this Saturday. We want to hear you. We want to get your feedback. All of the people who have watched our videos for a year,
Yes.
plus who have heard what we had to say.
Yes.
That gentleman who called, I did not get his name, but I'm not sure if I met him. Maybe we did, maybe we did not. This is your opportunity to get involved. None of us have been politically involved before, but
No.
this is the time. the time to stand up for Trinidad and Tobago is now. Saturday, join us, 19 Stanmore Avenue, Port of Spain.
From 12 noon.
We do this every single Saturday. And I tell people, 2 years ago, my Saturdays were reserved for beach, linemen, and partying and beers.
Yeah.
I do this as a young woman because this is more important than any of those things. In a couple of years, if we don't fix the country, it have no more linemen and partying and beers.
Yeah.
It have trying to get on a boat to get out of here or plane. So, don't waste your opportunity
Yes.
to add your voice to ours. We need you. We want you here. Come. We usually have snacks and cake and ice cream and chocolates and boats and anything. Come buy your cups, your merchandise. But mostly, come and hear real
Interact
solutions.
with the team.
Interact with the team and hear what real solutions sound like. Sarah, impromptu,
Yeah,
thank you
yes.
very much. You know,
Thank you for being-
did I tell you how this happened over lunch?
No,
Philip
no.
was like, I said, well, we just left the hospital with Janice, Philip, Sean, and myself. So, well, Philip, you know, you have to join me on front lines. And he's like, no. Yeah. No. I'm like, okay, why don't get Sarah and Abby? I said, brilliant. And
Okay.
he called you and you came through really well.
Yeah.
Janice, darling, lover, I really hope we
Yeah.
made you proud.
Yeah.
And
We want to toast to your health.
we are going to toast to your health.
An orange toast.
I'm sorry, it wasn't the actual pep cup.
Because
Guys,
it's sold out.
we sold out. We have to drink from the unbranded cups now because even down to that, people buy out our cups. Thank you very much for giving
Thank
us
you
your
for
time and
having me here.
attention. Sorry for starting late and sorry for ending late. But again, really appreciate you guys being here. And
Being with
Sarah,
us.
thank you for coming.
Thank
and
Stay safe, Trinidad and
stay
Tobago.
safe and see you next week.
Good night.